Broadcasting from the business capital of the world, this is the Podcast Business News Network. Hello, everyone. Welcome to the show. I am Ross Morasso, for those of you who've tuned in before. Welcome back. My guest today, Dr. Brandon Fuller, acupuncture, stress relief. You can find him at absolute-acupuncture.com. So it's like the hyphen in between the two words, acupuncture, absoluteacupuncture.com. Dr. Brandon, welcome to the show.
Thank you. Thank you very much.
If I could jump out right away with this, when COVID happened, it forced kind of planet Earth, right, to run out and looking for alternative therapies. And I think it resulted in, to some degree, some happy accidents. But one of the good ones was a lot of overall awareness. And I've been hearing a lot more about acupuncture lately. I know it's been around for thousands of years, but go ahead and tell us, what is this really? What does it do? What can it do? How long has it been used for?
So it's been used for about 3,000 years, and it treats all kinds of different ailments, from common cold to things like pain, or even a lot of individuals now are being diagnosed with GERD or acid reflux or things like that from the stress and just sitting at home, as we all did at COVID time, just eating away. So there's a multitude of different situations that acupuncture and alternative therapies can help with. Especially in COVID, a lot of my patients had a lot of anxiety towards getting sick and, oh, what do we do? The vaccine's not out yet, especially in the beginning. And so the acupuncture actually helped ease the anxiety, and there are natural ways to just boost the immune system and help prevent any infections.
Do you think acupuncture has a place in sort of general wellness, like to use outside of any particular ailment you currently have?
Absolutely. 100%. There's a saying I like to use with my patients. It's we always say, well, diet and exercise will keep you healthy and strong, but there's diet, exercise, and acupuncture. And that just helps reduce inflammation in the body, helps blood flow go to where it needs to go, helps the body recover more quickly from more vigorous exercises, helps with digestion if you eat something a little funky, that sort of thing. So it's a great part to add into that diet and exercise regime to stay healthy.
So do you have people that just come to see you, I don't know, weekly or monthly or something like that, just because, whether I need it or not, sort of deal?
Absolutely. Yeah. Generally we start with an every other week, just to make sure, okay, we're getting everything balanced. There's no symptoms popping up, or, they've worked out hard. And then we go, let's just come back once a month, once every other month, something like that, just as a tune-up for the body, helps the body heal and helps people keep going and stay healthy.
All right, now walk me through this though. I know if I was going to talk to my daughter, her initial comment would be, "You're going to do what with a bunch of needles with me?" So explain to me how these sessions actually go. Are they uncomfortable, painful? Are they blissful? I mean, what is it when I walk in? What do we do after you figured out sort of a treatment plan for me? How do these things look?
So we use what's called filiform needles. They're about the thickness of a cat's whisker, and sometimes even thinner than that. They're placed all over the body, depending on what's going on with the individual, what we need to work on. And then once they're inserted, you rest for about half an hour. So most of the time, patients will fall asleep before I'm even done putting the needles in. Most patients don't even feel the needles going in. Then they get a little nap for 30 minutes or so, and I come back and maybe we do some cupping or a Theragun session, a little tidbit just to add on to the end to help people feel really good, and then that's it. And you're set. And most people leave with a smile on their face.
I was going to ask you about that. So if I'm having chronic pain, let's say, that would be maybe an obvious one, right? How long or how many treatments or whatever, what is typical in terms of experiencing some relief?
So typically, if it's pain, say You came in with back pain. I normally will suggest twice a week for 5 weeks, and then we reevaluate. More often than not, patients will find relief somewhere around treatment 5 to treatment 7. So they feel better. They feel like they can get back to regular activities without causing a spasm in their back or something of that nature. Um, and then those last couple treatments we have, we put you on kind of a maintenance plan. So we go, okay, well, maybe you come in every other week just so that we keep that healing process going and you don't re-aggravate. Now, if it's something like, oh, I just bent down to pick something up and my back went out, usually it's 3 treatments, 4 treatments, something like that. Patients feel better. So it varies a little bit depending on the pain and how long you've had it and severity and that sort of thing. But for the most part, it doesn't take too long to see results.
A lot of us in America, North America, probably just all over the world, right? Like we're all dealing with chronic pain, but after a while, it almost just becomes like a new normal for you.
Yeah,
So, does acupuncture have a place for those of us that don't have this acute pain, that are generally getting by in life, but are just, a little bit more grousy about it because the old knee is talking to me?
absolutely, absolutely. Yeah, and those are actually most of my patients that I see, because they've tried all the different avenues. They've gone to medical doctors,
Mm.
they've gone to physical therapists, they've gone to chiropractors, and they go, it's just not getting any better, no matter what I do. And then they come in for acupuncture, and we go, okay, well, we have some work to do here. You've had this for a long time. One of the things that's kind of interesting to note about chronic pain is it's different than an acute pain. In acute pain, our body sends those signals back to the brain and says, "Hey, you have pain. We need to fix this. This is a problem." In chronic pain, it's like the brain goes, "Hey, you had pain there. I know that there might be a little bit of pain there, but I'm just going to keep the signals going, letting you know that there's still pain, even though things might not be as inflamed as they were, or they might not be as problematic as it was in the acute phase. You still have that constant pain where your brain is being triggered to say, hey, you've got pain. And so we need to adjust kind of how we treat to tell the brain, hey, it's okay, we got this now. And usually at that point, the brain goes, okay, good, somebody else can take care of it.
Yeah, let's talk about that for a second. I've
Sure.
I've heard it sort of said in a layman's terms how a bank robber says, "Don't try anything funny." That
Yeah.
sometimes this lingering pain can be tricky because
Mhm.
your injury or whatever would be causing the pain is gone, but your brain is just sort of like, hey, but let's
Right.
just not go run the any tough mutters just yet. How
Yeah.
so does acupuncture then is what you're saying that
Mhm.
when you have this lingering pain signal,
Yeah.
even though your body is in good shape,
Yeah.
that you can use acupuncture to shut that down?
There is. And so a lot of times, uh, I look at it from kind of, if we look at it from a Western medical standpoint, right? And you have somebody who goes, oh, I still have pain, and they take pain medication. Well,
Mm-hmm.
the pain medication gets rid of inflammation and whatnot. But then when you stop pain medication, the body goes, okay, well, I didn't have to do all that work for a while. Now the inflammation comes back, and it comes back sometimes tenfold, right? So acupuncture helps to just reduce any leftover inflammation in a way. So we help the body kind of heal itself naturally, kickstart the brain going, you've got some work to do, and I'll take care of the other stuff, and don't worry about this, we'll take care of that, and that sort of thing.
Right. So you catch people, and
Yeah,
sometimes the pain is painful.
right,
And so sitting around every hour can be miserable, right? So
right.
waiting for your brain and body to realize that it needs to start doing its job because the medication is gone.
Yeah.
might seem like an eternity. So you're saying
Right.
that the acupuncture then sort of gives some rocket fuel there to the brain to
Yeah.
get moving?
Absolutely. Absolutely. Yeah. Yeah.
So, I'm looking at you and you look like you're, 25 years old, but I have a feeling you've been doing this for a minute. So, how did you get your start here? How long have you been working with acupuncture?
So if we include all the patients that were seen kind of during the med school side of things, it was 17 years that I've been treating patients for all various types of things, from shingles to back pain to knee pain to shoulder pain to common cold. You name it, I've probably treated it.
And how long of those 17 years has it been acupuncture that entire time?
All of it. Yep.
Really?
Yeah. Yeah. Yeah.
Okay, so and you teach people now how to do this?
I used to. I used to. So I was a clinical director and the kind of the dean at East West College of Natural Medicine for about 8 years, where I taught students how to treat other patients and treat people in the community. And then I said, okay, well, I want to keep my practice going, and rather than doing paperwork in the world of medicine, I went forth and just focused solely on my practice. Nowadays, I try and treat a lot of advanced cases of different issues. So I have patients right now who severed nerves in the bottom of their feet from stepping on an oyster bed, to um, those who have different mental disorders like bipolar disease, to you name it, thyroid disease that's lasted long term, or different patients with long COVID where the vagus nerve has been affected and it's causing wreaking havoc throughout their body.
So, when you say throughout the body, this is
Mhm.
something I was thinking about that I'd read a little bit about. So inform us on this. If I have pain in my right foot, using an example,
Sure,
the and acupuncture did originate in Asia, right?
it did. Yeah,
Okay,
yeah,
so there's more of a full body mindset that just
right,
because your pain might be in your foot doesn't mean that that's where the source of the pain is at. So, how do you
right.
work with acupuncture? When you say you got to go at the source of the pain, like what does that mean?
So generally, to try and find a source, we might do orthopedic evaluations just like a Western medical doctor would do. So if you came in with pain in your foot, we might look at your gait and how you walk. We might check to see if there's any nerve impingements in your back that is affecting your foot, and the nerve that runs to the foot. We might check different nerves in the foot in case there was some sort of trauma. So we're going to take a look kind of at that whole body and where things start to where they end, so that we can see and get the full picture. That way we can treat you the best possible way.
The muscles and tissue in our foot, of course, is a lot thinner than just say like in our sadly bellies.
Right.
So, can you still do acupuncture though in those sorts of areas of the body where the skin is thin?
Absolutely. Yeah. Absolutely. 100%. And there's so many acupuncture points, and quite a few of them are in the feet and in the hands. And so it's just knowing the anatomy really well so that you're not hitting major blood vessels or hitting nerves and that sort of thing, not causing undue pain to the patient.
Okay, so how does somebody like you, Dr. Brandon, and for those of you who had joined in with us, I'm talking with Dr. Brandon Fuller from Absolute Acupuncture out of Sarasota, Florida. You can find him at absolute-acupuncture.com. And so this seems to be, in terms of medicine, a bit of a road less traveled. However, you could probably tell me there's thousands and thousands of practitioners. But how do you learn that this is an area that you want to dedicate your life to? What called you to this?
Um, it's an interesting story. So I wanted to be a trauma surgeon. I thoroughly love treating different traumas that patients have. It's something that I enjoy kind of the puzzle and how to solve it, and the kind of freshness of a trauma rather than something that's been long term and it's a lot harder to fix type thing. And when I was in school for my undergrad, one of the one of my professors was a medical doctor and an acupuncturist, and he
Mm.
went, I want you to try and get acupuncture. I want you to try it. And I went, no way. I'm not going to let you put 100 needles in my body and say, there you go, I'm cured. There's no way. I was very much against acupuncture from the get-go. And he finally talked me into it. And I did one treatment. And I remember coming out looking at him and going, what can this treat? And he just looked at me and he goes, it's better to ask what it can't treat because it's a lot easier to answer. And I went, so you can treat trauma, you can treat, like cuts and wounds and things like that. And he goes, absolutely. And I went, I'm in, I'm changing tomorrow. And from that point on, I've run with it and I love every minute of it.
You nerves and tendons can be
Mhm.
notoriously stubborn to heal, right? Like you're not
Yeah,
dealing with even days or weeks sometimes, it could be like months and months, right? Do
right.
you think that, or are you saying that acupuncture though can speed that along?
It can. It can. I will use myself as an example. I've I've sprained, strained, I've broken bones, that sort of thing more oftentimes than I care to admit. And I've primarily only ever used alternative medicine unless it was a severe break and I needed, an x-ray to see or set my arm, that sort of thing. But thumbs, fingers, feet, um, generally it's just alternative medicine to fix it.
Now, it's not only the needles, though. I was
Right.
reading that sometimes you'll use other complementary
Right.
injections or things. What are those about?
So injections, they vary the different uses for them. More often than not, we use homeopathics, which the most common is Trameal. It's an anti-inflammatory. It's an anti-edematous, which means it reduces edema, it reduces swelling in an area, and it just helps the body heal a bit more quickly. For example, I had a patient in yesterday who goes, my shoulder's been in pain. We did a couple of tests. I went, your rotator cuff, it's probably torn pretty badly
Mm.
because of how that orthopedic test went. He goes, can you help me with the pain until I can get something done? It's, in between the new year and everything, doctors are going to book him 4 months out for a surgery. I said, sure. So I gave him a shot of Trameal into his shoulder, and I got a text this morning. Thank you. That was the best I've slept in months. My shoulder feels great. Thank you so much for your help. I appreciate it. So, these injections really do help heal the body, help with inflammation, help people feel better.
Do people use this like as an aid to recovery, like after conventional surgeries?
Absolutely. Yeah, 100%. And we do both a pre and post surgery treatments generally if we can get a patient in. So we can prepare the body for surgery so that anesthesia is accepted more easily, more readily, and then the post treatment to help everything heal a little bit more quickly. A lot of times, the post treatment, if patients will come in 2 to 3 times a week after surgery, they'll go back to the doctor and the doctor will go, wow, I've never seen anybody heal this quick. That's fantastic. What have you been doing? And they get a little nervous. They don't want to go, well, I went to acupuncture, but sometimes they say it and they go, just keep doing it. You're going to heal beautifully.
So with Western medicine, at
Sure.
times has been, at odds with some of these things that don't involve taking a pill or whatever. How is the general medical community warming up or cooling off towards acupuncture here, in 2022?
There there's still some of those out there that are going, acupuncture can't fix that. and it's true. Acupuncture can't fix everything, right?
Mm,
There's always a time and a place for everything. If you break your arm, you're not going to go to an acupuncturist and go, "Can you set this and then fix it for me?" You're going to go to the emergency room.
right.
If you get shot, you're not going to go to your acupuncturist and go, "Can you pull the bullet out?" And so there's a time and a place for everything. A lot of medical doctors are starting to see um, that we do have a place, and that some of the more stubborn patients that they're not able to do well with treating do really well with acupuncture. So I know a dermatologist down here fairly well, and uh, every once in a while she'll go, "I've been treating these warts on a person's hand." They use liquid nitrogen. They've tried
Hmm.
all the different things, and the warts just keep coming back. She'll send them to acupuncture, and you generally the warts then go dormant. They don't come back. They do really well as long as the patient sticks with the protocol.
You had mentioned this earlier on in the show, and it's something I had meant to come back to. So when you had talked about helping like with the cold, infections and viruses, these are generally considered to be pretty normal things where medicine comes into play. Or with viruses, antibiotics don't work, right? And you just say you
Mhm.
kind of just got to get your rest and have your chicken soup.
Right.
But you were saying that this actually can help though with that sorts
Yeah.
of things. And so when you mention warts or
Right.
wherever they are,
Yeah.
it works with all of that stuff.
It does. It does. It works wonderfully. Common colds and flus is one of the, I think it's um, 60 common diseases that the World Health Organization recognizes that acupuncture and herbal medicine can treat. So when the World Health Organization came up with a list of all these different diseases that they found over all this research acupuncture can help with, common cold and the flu actually was one of the top ones. And there's different herbs that work as antibacterial and antiviral in the body.
Right. So we're talking, well, I was asking, about how do you engage with American medicine? Now, the
Yeah,
WHO, that's international, right? So
right, right.
what's the differences between sort of its role or acknowledgement on the international stage versus America? Are they pretty in line or are they different?
They're definitely different. Definitely different. So the international stage, a lot of different countries prefer to go the alternative route before they hit the Western medical route. So they'll go, "I'm sore, I'm stiff. Let's try some herbal tea and
Mm.
see if that helps kind of soothe the body, get rid of my aches and in my joints and whatnot. Before we go, let's take an aspirin and a Tylenol. Let's take this and that." In the American community, I find it's more what's going to take care of it faster rather than what's going to kind of heal it from the inside out, right? So you go, "Hey, I've got work to do today. I've got a full day. I'm working till 8 o'clock tonight and I'm sore. I don't have time to go down to Dr. Brandon's shop and get the herbs and whatnot. I've got a bottle of aspirin in my desk. I'll just take a couple of those. I should be fine." It's a different mentality, I find. But it's swinging back around. Slowly but surely, people are going, "Well, I don't want to take the aspirin because it upsets my stomach and I don't feel good for a couple days afterwards. But I
Yeah.
know Dr. Brandon has the herbs that'll get rid of the pain and it's not going to hurt my stomach." So,
So with all of this being different, what would you say has been some of the more interesting um, revelations, research, evidence, stuff that's been coming out of late, or just even to say over the past decade about acupuncture? I mean, maybe you've been hinting at it at the show, but just to kind of put a finer point on it,
yeah,
I mean, I would say, in the 90s, this would have been almost a punchline, right?
right.
Unfortunately,
It's true.
what we are, what is, what are you, like medical journals or whatever, what sort of new emerging things that you wouldn't have thought? Like acupuncture helps with this now. What are some of those that are you've found surprising for yourself, or maybe for someone like me that doesn't know that much about it?
So a great one that's actually been endorsed by the U.S. military it's called battlefield acupuncture.
Mm.
And it's researched heavily, and it's just a couple of points in both ears. Using that, they have found that it's just as effective as any pain medication like opioids and whatnot, because it triggers the brain to think that it's getting those different pain meds. So then you don't have to use it, and patients don't feel pain, they don't feel anxiety. It helps with PTSD. Works really, really great for veterans coming back from kind of the war, Afghanistan, Iraq, those sorts of places. Um, with with patients nowadays, right? We have pain, we have the PTSD from a car accident, whatever it might be. It works just as effectively. So that's one of the newer things that has just come out in the past maybe 8 years. That's highly, highly effective.
Dr. Brandon, it's been really, really interesting to talk to you about this today. Tell everybody where they can find you if they want to learn more about this or work with you.
Right. So they can call the office, text the office at 941-500-2767, or they can go onto the website and shoot me an email from there. And it's absolute-acupuncture.com.
Okay. Any final thoughts for anybody out there? I always like to give all my guests the last word. What would you have to say to everybody who's been tuning in today?
The big one recently is be patient and be thoughtful of others, especially it's the new year and holidays have just ended. Everybody's kind of in a, oh, we got to go back to work, panic mindset. So just be patient with everyone, be thoughtful of everyone, and everybody's kind of in that same mode as you are. So keep that in mind.
To everyone, there are other things out there as we're hearing it directly today from Dr. Brandon Fuller. Dr. Brandon, thank you so much for being on the show today. I am Ross Morasso. Until next time.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.